Hey everybody, Dr. Terri DeNeui here, and I wanted to address a question that keeps coming up in our clinics with our patients, and that is, how should we handle or should we be afraid of this second wave of coronavirus that's, predicted to come down the pipe? And what should we do about it? So I'm going to go ahead and just share my thoughts and my opinions on this. A lot of it is based on data. We've been studying this virus and this pandemic, if you will, now for since March, and actually even sooner. There's many scientists and researchers that, saw this coming. So we do have a lot of really good data. So I'm going to share what we know. And the first thing I want to share is just not to be afraid. One of the things that makes me really sad is seeing how, anybody that coughs or sneezes out in public is kind of looked at like, they're, have the plague, if you will. So the first thing I want to everyone to understand is, even though this is a highly contagious virus, it has a very low death rate proportionately. So we'll talk a little bit about that in a minute. It's one of the reasons why I titled this blog, "Not Every Cough, Sniffle, and Sneeze is Coronavirus," right? So just remember, we're moving into cold and flu season. So now we have the common cold, we have coronavirus, we have flu A and B. So we do have a lot to try to protect ourselves from, but that is the key, is protection. There is no cure for viruses, but there are things that we can do to help prevent the spread in ourselves, to help our immune systems, our own bodies, fight off viruses. So the first thing I want to share is really some facts and some things that people need to understand to just not be steeped in fear around coronavirus. So in the U.S. to date, there have been over 8 million confirmed positive cases of coronavirus and about 228,000 deaths. So if you just do raw math, that's about a 2.5% death rate. So the deaths and the death rate are unfortunate. Yes, it's terrible, and I don't want to make light of this virus, but I also believe that we should not be living in fear. We should be smart. Have facts to deal with. Facts over fear. I always talk about facts over fear. So there are some statistics in the scientific community that actually report that our positive cases are approximately 10 to even 20 times higher than the reported cases. So if we even took that conservative estimate of 10 times more cases than what is reported, don't let that scare you. That's actually really good news, right? Because if you take 8.8 million and multiply it by 10, that's 88 million cases. And then if you take that 228,000 confirmed death rate, according to Johns Hopkins University, now that makes that a 99.75% recovery rate. That is phenomenal news. That is an exponentially higher recovery rate than the flu virus, as we all know. So I don't want to make light of it, because I personally have close friends that have gotten very ill. I've had one very close physician friend that was hospitalized for a week in the ICU. He sent me a photo of his chest x-ray, and it was kind of scary. So the coronavirus is a pretty nasty boy, as he said. But what can we do to help prevent? So that's really what I'm interested in sharing with you. So first, I want to give you some facts to allay fear, and then I want to give you some facts to help your body recover if you do get exposed, which the majority of us probably have or will. So first thing, we've been looking at melatonin and ascorbic acid. I did some blogs on this way back in March. I've done a lot of talks with other physicians on this, and now it's pretty common knowledge that vitamin C definitely is wonderful antiviral, but what it does specifically in the coronavirus is it decreases the inflammasome production in the lung, which converts this and transition this viral infection into the SARS part, which is sudden adult respiratory distress. So we know ascorbic acid does this, and you can read down in the blog on the doses and the amounts that we have seen that work. Well, and we also know melatonin. Melatonin has long been known to be what, as one scientist reports, is the most potent antioxidant known to mankind. We always think melatonin is for sleep. It's really not for sleep. It is secreted during sleep, and that secretion definitely decreases like every other hormone as we age. So as we move into our 40s and 50s, we can expect to have very little melatonin production compared to children. This is a theory around why children and pregnant women aren't getting as sick with the coronavirus, is because they produce so much more melatonin. So again, melatonin, especially if you're older, if you're exposed, if you're a night shift worker, melatonin very important. Zinc, vitamin D, but we do know that melatonin and ascorbic acid have studies directly related to coronavirus. There are some other little tips and tricks that I use in my family for over-the-counter things that if you get exposed to any cold or flu. And then the last thing I'm going to touch on is the really number one way you can prevent is diligent hand washing. I can't express that enough. We've known this for decades. When I was an emergency room provider during the swine flu endemic, and I diagnosed over 200 cases of swine flu, tons of flu A, flu B, bird flu as well, and I never got sick. Why? Primarily, I believe not only was I taking a lot of vitamin D and iodine and helping my body, but I did diligent hand washing. So let's not forget the basics. Hand washing, don't touch your face. These are kind of obvious, but we forget. I want you to pay attention to how many times you touch your face today. I guarantee you it's a lot. And that phone too, we get the phone all dirty and it touches our face. This is how this virus and all viruses are spread. What I want you to understand is this virus isn't spread just by standing in the same room with somebody with coronavirus. It's not that way. It's a heavy droplet spread, right? So it has to, there has to be prolonged exposure. In fact, the CDC even says prolonged exposure with somebody who's positive or confirmed positive. That's not a casual interaction at the grocery store. That's caregiving. That's sleeping in the same bed with, living in the same household with, right? So that is really important to understand. And of course, please don't forget to continue to wipe down your surfaces, wipe down door handles. This stands for every virus in the cold and flu season, not the least of which is the novel coronavirus. So I hope this information helps you. I hope to and wish you a very healthy and safe holiday season. We're coming up on the holidays, and if you have any questions, we are so happy to help you here. We're all about wellness. We're all about prevention. Have a great rest of your 2020.